Prostate-specific antigen PSA, an in-depth look. Introduction, definition. PSA is a protein produced by the prostate gland, commonly measured in blood tests. Clinical use of PSA. Prostate cancer screening. Elevated levels may indicate the need for further investigation, such as biopsy. B. Monitoring prostate cancer treatment. Following prostate cancer treatment, PSA levels are monitored to assess treatment efficacy, and a rising PSA level post-treatment may suggest recurrence. Limitations of PSA. Lack of specificity. 1. PSA levels can be elevated due to conditions other than cancer, for example, benign prostatic hyperplasia BPH, prostatitis. 2. This lack of specificity led to concerns about unnecessary biopsies and overdiagnosis and overtreatment. Elevated PSA does not always indicate clinically significant cancer. 3. Over-reliance on PSA has led to unnecessary treatments with potential side effects. Modern tests replacing PSA. A. Prostate Health Index PHI incorporates total PSA, free PSA, and -2 PSA. Improves specificity in distinguishing between benign and malignant conditions. B. 4K score combines total PSA, free PSA, intact PSA, and human K-Ali-Crane 2. Provides a percentage risk score for aggressive prostate cancer. C. PKA3 test. Measures the expression of PKA3 mRNA. Particularly useful in repeat biopsies for men with a previous negative biopsy. Clinical use of modern tests. A. Improved specificity. Modern tests address the specificity issues associated with PSA alone. Reduced unnecessary biopsies and overdiagnoses. B. Helps for risk stratification. Modern tests offer better risk stratification, aiding in the identification of clinically significant prostate cancers. Helps guide decisions on active surveillance vs. intervention. Normal values and interpretation. SA. 1. Normal PSA levels vary with age, but typically is for ENG or ML. 2. An increasing PSA trend over time may prompt further investigation. Conclusion. PSA remains a valuable tool in prostate health, but its limitations necessitate the integration of modern tests. For improved specificity and clinical decision-making, medical professionals should stay informed about evolving guidelines and utilize a multidimensional approach for optimal patient care. This lecture aims to provide medical students and professionals with a comprehensive understanding of PSA, the limitations associated with its use, modern tests replacing PSA, and the clinical applications, including normal values and interpretation.